Could a virus be causing your chronic fatigue? Hi there, I'm Laura Dankoff, nurse practitioner and founder of PathToHealthAndHealing.com. Today I want to just talk to you a little bit about the possibility that a virus could be contributing to your chronic fatigue, your fibromyalgia, your Hashimoto's, or a trigger for other autoimmune diseases. But specifically today, let's just talk about chronic fatigue. I stumbled upon this with a patient of mine. We learned so much from our patients over the years who was struggling with fibromyalgia. And she had come across some information on the possibility that viruses such as Epstein-Barr virus, which causes mono, cytomegalovirus, human herpes type 6, and parvovirus B19 might be factors that can be a trigger, possible trigger for chronic fatigue and fibromyalgia. So I started to look into this further and started testing my patients that were suffering from these conditions, and lo and behold, all of them had findings that they had these viruses in the past. And we look at that by looking at what are called IgG and IgM. These are immunoglobulin or immune markers. Now, one could argue that these did not appear as active infections, but the fact that they were there and they were consistently there, I always found at least 2, if not all 4 of the viruses when testing someone. It really made me suspicious. And what I found with some of the works of Dr. Dantini in particular was actually treating people with antiviral therapies to see if it would help control their symptoms. So I went ahead and we did trial this, and since there is some research also out there and more that are getting behind the idea that these viruses could be factors with some of these conditions. And I found that those that I trialed the antiviral therapy with, they actually, I'd say 50% of them saw improvement, some miraculous improvement. And if they failed that, then we tried something called low-dose naltrexone. So that basically is Narcan, which is a drug we use to reverse drug overdoses, but at a very small amount, compounded. It has been found that it may help a whole host of conditions, including chronic fatigue, fibromyalgia, autoimmune diseases, among other things. And what it's found to do is it helps your immune system deal with whatever it might be dealing with. So if I had somebody that maybe did not see as good of results as they had liked from the antiviral, we would then try the low-dose naltrexone. And it, quite honestly, for some people it could be life-changing. I'd say it's probably about 50% in my experience. So if you're suffering from one of these conditions, I'd certainly encourage you to seek out the guidance of a functional medicine practitioner who has knowledge on this subject and has treated others with this condition. Now, I do want to preface this by that's not the only thing that can be a contributor. Certainly we need to look at a broader view of things and look at lifestyle and stress and hormone balance and nutritional deficiencies and underlying other infections such as candida or yeast, parasites, food sensitivity. So there's a lot of other things that can be going on there as well. But certainly this is just one of those things that are worth taking a look at, and certainly can make a big difference in your life if you're struggling from chronic fatigue. So yes, viruses could possibly be a contributor. I hope this helps, and have a great day. If you want more information, visit my website at www.pathtohealthandhealing.com.